Thank you all. As you all know that the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students and doctors. And we are conducting regular sessions from 7 to 8, our Hindi session, 8 to 9, our international session in English, and 9 to 10, we have a local language session in Malayalam. Today, our guest is Dr. Neha Kakkar from Uttar Pradesh, and she has completed her B.H.M.S. and from Delhi, and now practicing at her own clinic named Homeo Cure and Care Clinic, Meerut. And she is a member of Meerut Homeopathic Medical Association, as well as Red Cross Society, Meerut, South Delhi Homeopathic Association, and she has presented paper on a topic on cancer, its homeopathic etiology and management at All India Homeopathic Congress held at Hyatt, New Delhi some 3 months back. That is on December 2023. That means that she is an international figure by herself. And she has written published some articles, and she has published the same in the 360 website. One is Homeopathy, a Nanoscience, and the other second article is A Case of Blackish Discoloration of Skin along with the erythematous patches cured with Natrum muriaticum. And today, Dr. Neha will be discussing about the role of homeopathy in genetic disorders. As you all know that homeopathy is a very good system for this genetic disorders, but only very few people know that this is a good thing for all those kind of diseases. So let us see what Dr. Neha Kakkar has to say about this subject and what she has her experience in this field. Welcome, Dr. Neha. Please unmute.
Thank you, Dr. Dinesh sir, for this wonderful introduction. First of all, I want to convey my heartfelt gratitude to International Forum for Promoting Homeopathy for providing me a distinguished platform to present my presentation. And I want to convey my special thanks to Dr. Dinesh B.H.M.S sir for introducing me into the forum. It all started up with he calling me for just giving a vote of thanks to all the presenters. And one day he called me up and asked me whether I can give a presentation also. So I agreed to it, and I'm here. And I hope I can do justice to the topic what I'm trying to explain today. And I also want to thank all the doctors present here in advance who will be lending a patient here to my presentation. I hope that will be fruitful for all of you. So moving on to the presentation. I hope everybody can see my screen.
Yes, it's fine.
Yeah. The topic of my today's presentation is role of homeopathy in genetic disorders. To understand this topic of genetic disorders, we need to first understand that what structures are present behind the genetic disorders and what are the changes are occurring in these structures which bring about the development of genetic disorders in individuals. So the basic structures we need to know before going on to the genetic disorders is that we should know that what exactly are genes. Now, genes are the basic and the smallest submolecular, that is nano or micro. They are the smallest submolecular physical and functional unit of a cell or an organism. Genes are present inside the chromosomes, which are present inside the nucleus of every cell and which are inherited from our parents or ancestors. Genes are responsible for the physical and structural makeup of a cell and also of an organism. They control the most essential functions of the body. So now to understand this concept of genes, we need to go back to our biology classes or the physiology classes that we took in our B.H.M.S courses. We need to go back to that. As you can see in the diagram, we have studied about the microscopic structure of the cell, whether a unicellular organism or a multicellular organism. This is the microscopic structure of the cell, which is there. So here you can see the cell has a cell membrane, that is the outer covering of the cell. And we have some important components inside the cells like the mitochondrion, Golgi bodies, endoplasmic reticulum, lysosomes, etc. And we also have the core of the cell, that is the basic powerhouse of the cell, that is the nucleus. Now, in the second diagram, as you can see, this is the detailed diagram of a nucleus. The nucleus is the main structure inside the cell, which is controlling all the functions of the cell. And this nucleus, in turn, contains the chromatin fibers. The chromatin fibers contains the chromosomes, which we inherit from our parents or ancestors. And inside the chromosomes are present the basic genetic material or the genetic information, which has information about whole of the physical and the mental traits a person or an individual is going to have in future. Now, in this diagram, we can see all the 23 chromosomes which we inherit from our parents. These are responsible for different physical characteristics like the color of the hair, the color of the eyes, the color of the skin, or other, behavioral characteristics like a person's way of speaking or behaving in a certain manner, and a lot of other things. They are determined by the chromosomes. And here we have the 23rd chromosome, that is the double X or XY chromosome. This is responsible for the sex of a person, whether the person is a male or a female. So this chromosome, 23rd chromosome, is responsible for that. Double X chromosome means a female chromosome, and XY chromosome means a male chromosome. So these chromosomes contains the basic genetic material inside them. Now, what is these genetic material, the genes, exactly further made up of? They are further made up of DNA, that is deoxyribonucleic acid, a self-replicative polymer or molecule. This is a chemistry molecule, which we all have studied previously also. And it is further made up of nucleotides, which are namely adenine, thymine, guanine, and cytosine. So these are the 4 basic nucleotides. Nucleotides are further made up of these molecule. This is the basic molecule, as you can see in the diagram. This is the basic molecule of a nucleotide, which is consisting of a nitrogenous base. Nitrogenous base means it's based mainly containing the nitrogen molecules or atoms. And along with it, there is a pentose sugar molecule and also a phosphate molecule. So this is the component of a basic nucleotide, and we have 4 types of basic nucleotides that are namely adenine and thymine and guanine and cytosine. So here we can see these 4 nucleotides have different molecular structures. This adenine is having 2 molecules of hydrogen. Here we have 3 molecules of hydrogen. Here the alignment is different in cytosine. So these are the basic 4 nucleotides which are forming up the DNA. And now in this diagram, you can see how these molecules of nucleotides are arranged. It's a rule that thymine always bonds with adenine and guanine always bonds with cytosine. So the sugar phosphate part forms this double helix structure. The sugar and the phosphate thing which we saw here, this phosphate and pentose sugar forms the double helix structure, whereas the nucleotide is forming the base part. This is the middle part is formed by the nucleotides, and this helix part is formed by the sugar phosphate molecules. So this is the basic pairing of nucleotides and how the nucleotides are arranged in the DNA. This is shown here. Now again, to summarize this thing, we can see here, this is the chromosome. The chromosome is the DNA coiled upon itself. As you can see here, it's coiled upon itself. And as we open it up, we see that gene is opening up here, and the gene is turning into a rope like it's a loose rope like structure. As you must have seen a rope. If it's tied loosely, it will just look like this. So this rope like structure is the DNA, and as we further open it, we see the different nucleotides here. Now, how these nucleotides are responsible for the formation of different amino acids and proteins, which are responsible for carrying out different bodily processes and functions. Now, every enzyme and hormone that is present in the body is mainly made up of protein. If you open up the hormones and if you open up the enzymes, they are basically containing polypeptides and proteins. So the protein is the basic structure which is responsible for many functions in the body. So these nucleotide bases group up in three they group up together in three parts, like they group up of three nucleotides, and they form a codon. Codon meaning they form a particular code which contains the information to form a particular amino acid. And further, the sequence of amino acids form a specific protein in the human body, which is responsible for various functions. This is being explained again in this diagram in detail. As you can see here, this is the cell structure, and we have the nucleus inside. The DNA is containing the nucleotides, and the nucleotides are transcripting or transferring this information to a messenger RNA. Now, RNA is a smaller molecule than DNA, but it is similar to DNA. It is very similar to DNA, but it is a bit small, and there is one or two components different from DNA. So what is DNA doing? DNA is transcribing this information into mRNA about what kind of amino acid it needs to manufacture, and then mRNA is traveling outside the nucleus of the cell into the cell cytoplasm here, and it is again translating this information to a ribosome. Now, ribosome are also protein-like structures which are responsible for formation of big proteins or amino acids. So DNA is transferred to mRNA to ribosome, ribosome, and the ribosome is again forming the amino acid. Now, as we can see, it's all written here. I will just read out from here. The bases from DNA to proteins. The bases on a single strand of DNA acts as a code. The letters form three-letter codons which code for amino acids, the building blocks of proteins. The amino acids are the building blocks of proteins. An enzyme, RNA polymerase, transcribes DNA into mRNA. It splits apart the two strands that form the double helix, then reads a strand and copies the sequence of nucleotides. The RNA is copying a single strand from the DNA. As you can see in the picture here, it's the nucleotides are lined up here, and the mRNA is just copying. Now the only difference here is that RNA is containing uracil. This is a different type of nucleotide which is different from the DNA. Now, instead of thymine, it is copying uracil, and the rest, that is the cytosine, guanine, and adenine, they are copied as it is. But the thiamine is being converted to uracil. It's written here, the only difference between the RNA and original DNA is that in place of thiamine, another base with a similar structure is used, which is uracil. In multicellular organism, the mRNA carries genetic code out of the cell nucleus to the cytoplasm. Here, protein synthesis takes place. Translation is the process of turning the mRNA's code into proteins. Molecules called ribosomes carry out this process, building up proteins from the amino acids coded for. So the DNA is transferring the information to mRNA, then to the ribosome, then to the formation of amino acid, and then the protein. I hope I'm clear on this. And these are the different type of amino acids, as we can see here: alanine, asparagine, glutamine. These are the 20 basic types of amino acids, and we have the different codons here. These are the codons. Now this codon is carrying the uracil, and uracil, cytosine. This is forming phenylalanine. And similarly, you can see the other amino acids also, they have different codes here. So there is a specific code for every amino acid, and then this amino acid is further forming the proteins. Now, what is a human genome? Genome is the entire set of DNA instructions found in a living organism. That means every organism is having a total amount of genes. Any organism, whether it's a virus or a bird or an animal or a human being, every living organism is having a fixed amount of genes in their DNA, which are carrying out different functions in their bodies. The full human genome was coded in the year 2003, after which, as a science, developed very fast and opened new vistas in the modern medical field. Humans have approximately 20,000 to 25,000 set of genes, which are responsible for physical and mental traits. They are responsible for carrying out the most important functions like growth and metabolism of an organism, and are also responsible for development of various diseases. Now, here also you can see the various functions of human genes. You can see the different varieties of function the genes are providing, and they include mostly, very important functions like cell adhesion, carrier proteins, viral proteins, and we have this immunoglobulins. It is also forming, the proteins are also forming our immunological system, and this calcium binders and structural protein of muscle. So they are carrying out various functions, and this amount of molecular function is still unknown, but still we know a lot than before. Due to the discovery of this human genome, the genetic studies have researched very much, they have developed very much fast in the last 2 decades. So this is the basic information we have till date. Now, I hope I'm clear up to till this days. Anybody is having any doubt on this, they can ask their questions later on. Now, from genes, we are moving on to genetic disorders. What exactly are genetic disorders? Genetic disorders are mutation or alteration in the nucleotide sequence forming the base amino acids. Genetic mutation occurs when the nucleotides, just a minute, nucleotides or gene segment get altered in their sequence or patterns by the process of insertion, substitution, or deletion of the mentioned nucleotides, that is adenine, thymine, guanine, cytosine, which further produces incorrect amino acid sequence, and which in turn produces a malfunctioning protein. Now, in this picture, you can see this is the normal DNA here. It's written here, it's the 3 nucleotides are AAA and ATG, CTT, CTC. This is a normal DNA, and it is giving rise to a normal mRNA, which is forming the different amino acids here. This PH is phenylalanine, tyrosine, glutamine. So these are the different amino acids. Now, what is happening in genetic mutation? In genetic mutation, these nucleotides are either getting substituted by another nucleotide. Like here, we can see instead of G, you have A here, and it is giving rise to a different amino acid, that is the lysine. So due to that substitution of the gene, the amino acid formed is different from the original one. Secondly, we see here that an extra gene is being inserted here. Here, instead of CTT, we have CCT. So the gene is getting inserted here, and that is also giving rise to a different amino acid sequence. And similarly, in the third part of the diagram, we can see there is a deletion of gene happening. A single nucleotide is being removed from the sequence. So that is also giving rise to a different amino acid sequence. So with the process of substitution, that is substitution of a single nucleotide with a different one, addition of an extra nucleotide. Here also in this picture, you can see there's an extra nucleotide being inserted in between, and also a nucleotide being removed, or even in this part, you can see that that nucleotide sequence is being inverted. It's being exchanged. So this is the process of gene mutation that is happening at the DNA level. The nucleotides are either being inserted or deleted or being getting substituted and giving rise to a faulty amino acid to a faulty protein. Here you can see there is error occurring within a gene during replication, error occur within the RNA polymerase during transcription, then the signal that is transferred is incorrect and the ribosome formed is also incorrect, and further the protein that is formed is also incorrect. So the whole chain gets affected because of the single nucleotide changing. The whole cycle of protein reproduction and amino acid reproduction is getting faulty. Now there are two major types of gene mutations. One is point mutations and other is chromosome mutations. The point mutations include mutations only at one of the bases. They include mutations only at one of the bases, and that means the only one base is either getting substituted or inserted or deleted. But in the surface area here in point mutation is very small. Only the gene which is getting mutated is only one or either two. But in chromosomal mutation, the whole, bigger area of the DNA gets affected, which might involve a multiple number of genes. That means the surface area, the strand, the area of that strand that is being affected can be longer. And in point mutation, it's a quite a smaller area, and the genes present here are either one or two in number, but in a larger area, obviously you are going to have different and large amount of genes. So as we will discuss further, I guess homeopathy can prove to be effective more in point mutations than in chromosomal mutations, because it is affecting a larger surface area, and the implications of a chromosome mutations are greater than the point mutations. As you can say here, in this chart, the differences between a point mutation and a chromosomal mutation. Point mutation is a single nucleotide change in a DNA or RNA sequence. This is a structural or numerical change. Even the number of chromosomes are changing in chromosomal mutation. There is a single base pair. Total number of chromosomes in a chromosome set gets changed. Impact is comparatively low. Impact is high. Here, mostly insertion or deletions are taking place. But in chromosomal mutation, duplication, translocation, inversion, deletion, disjunction, etc. Now these terms, there is less of time, so if anybody wants to go into deep into this, you can get the information on the internet and from the genetic books based on genetics. Also you can read them and you can easily understand these terminologies. Now the basic diseases which are coming under point mutations are sickle cell anemia, hemophilia, cystic fibrosis, Huntington syndrome, Tay-Sachs disease, and certain type of cancers. And in chromosomal mutation, we have Klinefelter syndrome, Turner syndrome, and Down syndrome. Here, the number of genes that are affected, as I previously said, there is a single gene or one or more gene, but here there are multiple or several genes involved. Now, what are the factors which can lead to development of genetic diseases? The modern medical science is only considering the physical and the radiation part of the factors, because they are only considering the physical part of the etiology. But we as homeopaths can also take the other part, that is the non-physical part, that is the mental part. So let's quickly see what are the factors. One of the factor can be viral and bacterial infections. Repeated exposure to these infections can produce genetic mutations. And obviously working in areas which have high chemical radiations, areas like nuclear reactors, people working in nuclear energy sectors, people working in hospitals near X-rays and MRI machines, there is a lot of radiation there. And people working in mines where there is a lot of chemical base. So these people are more prone to genetic mutations. Environmental factors like excessive heat and cold can also lead to decreased resistance of the cells, because whenever you're exposed to excessive heat or excessive cold for a long period of time, the cell will behave haphazardly. It will be very weak physically, and the functions that it will be able to carry out will not be up to the mark. And obviously repeated physical trauma, like you have repeated physical injuries, that also decreases the immunity of the body, and that also gives rise to genetic mutations. Now this last factor It is not very much considered by the modern medical science, but we as homeopaths, as we taken into the account the psychosomatic connections of diseases, we are very much aware that how the psychology of a person and emotional state of a person or the intellectual level of a person, all these things can affect cause an effect on the physical body. So this factor we can also take in account, and this can also lead to genetic mutation and further to genetic diseases. Now, these are the some of the genetic diseases which I have listed here. Obviously, there are many more genetic diseases there, but I have just listed down a few, like an albinism, ankylosing spondylitis, Down syndrome, cystic fibrosis, hemophilia, KBG syndrome, sickle cell anemia, thalassemia, muscular dystrophy, neurofibromatosis, Tourette syndrome, and Williams syndrome. So these are some of them genetic disorders which I have listed. Now, modern medical science or the allopathic fraternity claims to have no medicinal cure for the genetic disorders. There is no specific medicine over the prescription available for genetic disorder. Like in autoimmune diseases, we have doctors giving up steroids and other immunosuppressants. But in genetic disorders, there is no specific medicinal prescription available. The only treatment available is the gene or genetic therapy, which has evolved after the development of the human genome. The genetic therapy has come up. They are preserving stem cells from the womb itself, and later on they are introducing into the virus. They are building up cells which can fight the mutated genes, and they can provide a positive environment to the body, and the genetic disorders can be corrected. But this treatment is very, very expensive. The treatment can cost about in crores, and in a country like India, where middle class and lower middle class is just struggling to make ends meet, and they are just struggling financially to make the things available for them and for the children, it's very difficult to afford this kind of treatment if a person gets diagnosed with a genetic disorder. And this treatment is obviously not easily accessible to all. First of all, there is not so much awareness about it, and it is very expensive, and also it's not widespread, so not everybody can access to it. So now what can homeopathy help here? The genes get altered or mutated when they are exposed to certain types of negative environment. A gene will start manifesting and showing its symptoms whenever there is a environmental stress to it, whether it's a physical stress or infectious stress or chemical stress or mental stress. Any kind of stress will decrease the power of the body to resist, and that will lead to weaknesses inside the cell, and that will lead to development of genetic mutations. Now, if we provide a positive environment to the genes in the form of homeopathic medicines, the genes can again return to their healthy state through the process of genetic memory. Now, what is genetic memory exactly? There was a experiment done by a Japanese doctor on water. That water molecule also contains memory. Every molecule, every living molecule in this universe is having a memory. Memory means has the ability to feel things and to remember that what kind of experiences it went through. So this German doctor, I don't exactly remember his name, and I have not so much search about it, but I just put up this concept just to explain the concept of genetic memory, that when a water molecule is exposed to a negative environment, like you can see in the picture, it is forming it's a distorted molecule. But and in this case of evil or in negative, very negative environment, it's forming this kind of molecule. But if it's given positive environment of love and affection and care, it is forming this beautiful crystal here. So similarly, our genes also are getting affected by the negative environment, and they can be similarly can be treated with the positive environment, because the gene will have its previous memory of its own healthy state, and it can easily revert back to its healthy state if we provide the positive environment of the homeopathic remedy. The homeopathic remedy takes into the account the causa morbi, that is the causation from the point where the genes might have started getting altering or changing when exposed to certain factors. The homeopathic subject of repertory, this repertory is a gem for us because it takes into account of causation modalities like ailments from injuries, ailments from grief, ailments from anger, vexation, reserve, displeasure, ailments from bad effects of vaccination, ailments from excessive exposure to heat and cold, ailments from exposure to radiations, from to exposure to chemicals, ailments from excessive exposure to narcotics, allopathic drugs. Now, in the last few years, many new repertories have come up, apart from the traditional repertories of Kent and Bogar Boni Hassan and Dr. Bogar. So apart from these conventional repertories, and after the coming of the softwares and different repertories, recently I have recently means 2-3 years back, I've started reading the repertory of Dr. Robin Murphy, and this repertory includes a lot of modern day nomenclature, because now in today's times we are having bad effects of a lot of we are having toxicity of allopathic drugs, and we have toxicity of the vaccinations, we have toxicity from the negative mental load that is coming on from generations. So these all accounts are being taken care of on these kind of repertories. So it's my suggestion that everybody should read Dr. Robin's Murphy Repertory of Homeopathic Medical Repertory. That is the 3rd edition. And it contains a separate chapter on children and on toxicity, vaccinations, food, etc. And they have a wide range of rubrics. So these repertories help us to gain more knowledge about what the disease in today's times are. When we select the medicines based on these symptoms, which also acts as factors or environment for development of genetic diseases, and select mostly higher potencies like 1M, 10M, or even the LM potencies, we are providing a very positive environment to the genes. Genes here are nanostructure which are functioning at a subcellular level, after which only energy exists. Homeopathic medicine acts on this energy level and thus start bringing change on the genetic level, which is closest to the energy level. Now, let me connect our homeopathy with our Vedic texts. Our Vedic texts mention the concept of Atma, and Dr. Henneman has mentioned the concept of vital force. In my understanding, these two nomenclatures might be different, but they are serving the same purpose. Vital force is the basic force which is, maintaining the physical body. And similarly, it is mentioned that Atma is the basic energy which is, maintaining the physical body and making us alive. So these two terms are synonymous. And closest to this energy body or the Atma or the vital force is the Sukshma Sharir. The Sukshma Sharir is our mind, our intellect, our feelings, our thoughts. We cannot see our thoughts, we cannot feel our feelings, but we know that they are very much there. We are all in every day we are thinking multiple and thousands of thoughts. We cannot see them, but we can feel them. And the feelings which are closest to us are the feeling of sadness, happiness, and we feel them all the time. We cannot see them, but they are forming our Sukshma Sharir. So this Sukshma Sharir is our mind, intellect, and which is, the place at which the disease is getting introduced according to the concept of, disease as mentioned by Dr. Henneman. And the Sthul Sharir is our physical body, the physical body that we are seeing. So this Atma, Sukshma Sharir, Sthul Sharir is synonymous to vital force, the mind, and the physical body. So when we are providing energy to the vital force through our medicines, we are making an effect on the mind and ultimately on the physical body. This helps them to revert to the normal structure of amino acids and thus production of healthy and properly functioning proteins. Homeopathy as a medicinal system can provide the necessary breakthrough in the genetic field, providing relief in the symptoms of the patients suffering from genetic disorders and also improving their quality of life. Now, I have one case which I started seeing only 3 months back, and it was, a gift from Almighty. I considered as a gift from God, because this case came. Obviously, the the case was of a 7-year-old male child who was suffering from this KBG syndrome. This is a very rare syndrome, which we'll discuss further in the slides, and learning disability. And this obviously the child had seen many allopathic doctors, and obviously he was diagnosed as not treatable because it was a genetic disorder. And also the parents of the child also went to a very senior homeopathic doctor in Delhi. They consulted him. I would not like to name him because I really respect and revere him for whatever knowledge and wisdom he has about homeopathy, and he's a very, very famous homeopath. But he refused this case just by seeing that it is a genetic case. And the parents, through the reference of one of my patients who is staying in Meerut itself, he referred, he told the parents of the child about me, and they told him that you should consult Dr. Neha once, please. And on his request, the parents came up from Noida to consult me for this 7-year-old child. Now, this what exactly, first we will understand what is KBG syndrome. KBG syndrome is a rare genetic disorder which is caused by mutation in the ANKRD11 gene. The protein produced from this gene enables other proteins to interact with each other and helps control gene activity. The ANKRD11 protein is found in the nerve cells or the neurons in the brain. So this gene, or the gene which is associated with this ANKRD11 protein, is getting mutated, and this protein is found in the nerve cell or the neurons in the brain. So the common sign and symptoms in individuals, this condition include unusual facial features, as you can see here in the picture, skeletal abnormalities, and intellectual disability. Patient has a alien look on his face. This, as you can see, there's a broad skull, and the bones here are protruding down. So this child, the child who is suffering from this syndrome, might look like an alien. This was the term also mentioned for the patient I was treating. His name was the 7-year-old male child I was treating, and he also had this similar look. I'll show you the pictures in the later slides, how he looked like. KBG syndrome, first described by Herman et al., an American researcher, and is named after the surnames of the first families reported with the syndrome. The first families of this syndrome were given the name. Due to them, this name was given, the KBG syndrome. Very few cases have been reported of the syndrome. Obviously, it's a very rare disorder, and very few cases have been reported. This patient who came into my clinic was a male child of 7 years of age, presented on 30th November 2023 with key symptoms of intellectual disability, where his mother complained that he could not pick up and remember the basic alphabets of any language and also the numbers. Now, the main concern of the mother was that now he was 7 years of age, he went to a special school, and although he was 7 years of age, he was in nursery. He was not able to pick up the alphabets. He could not say A, B, C, D. He could not say 1, 2, 3. He could not say ka, kha, ga, ga. He could not say any of those because he could not learn them. And his concentration while studying was very low. He used to shriek and shout and refuse to study whenever his mother told him to do so. He would not sit to study because he would refuse, and he would run away, and he will say, I will not study, and he will just go and watch the mobile. He was so much into mobile watching that even while he was there in my clinic, I was talking to his mother, and he was watching the mobile and playing games on it all the time. His mother was majorly concerned with his academic performance and how the child will fare scholastically and academically as his age was increasing, but not his intellectual brain. The child could not drink milk from the glass or tumbler. He also could not sip from the straw and also could not gargle. Now, the gargle here means वो कुल्ला नहीं कर सकता था. उसको कुल्ली करनी नहीं आती थी और वो सिप भी नहीं कर सकता था, दूध नहीं पी सकता था. उसकी मम्मी उसको कटोरी चम्मच से दूध पिलाती थी. On taking the past history, it was found that the child had delayed milestones. His dentition was also late. He also started walking at a later age. At 2 years of age, he started walking. That is quite later than the normal walking age of the child, that is 1 or 1.5 years. Also, he could not speak and articulate words till 5 years of age. This was his, he could not speak till 5 years of age. He was like mumbling, just mumbling. This is all the things that mother told. At 3 years of age, he had an episode of high fever along with cyanosis of the face, along with first episode of seizure. He had high fever at 3 years of age, along with blue face. His face went blue, and there was episode of seizure. He was admitted in NICU and was given injection of allopathic drug called frisium and was nebulized for the cyanosis. He was fine after this, but 1 year later, he again had an attack of seizure along with vacant look and unresponsive behavior for a few minutes as described by his mother. He went blank. He was not looking. He was not answering to, he was, calling his name. His name was Saharsh, and the mother and father both were calling him, but he was not responding at the time of the second seizure that happened. After this episode, the patient consulted 2 or 3 specialists for this condition. Several neurological doctors were consulted, where several neurological tests were conducted to find out the cause of the seizures. But his brain MRI was found normal. No pathology was found inside the brain. The EEG, that the electroencephalogram, was also normal. There was no change in the EEG. And one more test was done on him. That was some sleep test. That report was not available with the mother, but the doctor repeatedly said that his sleep patterns were not normal. There was some disturbance in his sleep. There was this some test done to record his sleep pattern, and that sleep was not normal for him. This is the picture of the patient. And he was a very normal looking child. He came up and he was very vibrant, but he was a bit shy. I said hello to him, but not say hello to me. But he was a very calm and composed child, and nobody would have made out that he is having an intellectual disability. He was quite a normal looking child. But as you can see in the picture, this area of the face is showing the same alien like features. The head is a bit big here, and the bone here is similar to the picture I have shown, made you show this look. It's very similar to this. So that's why he was diagnosed with KBG syndrome by a doctor from Max Hospital in Safdarjung enclave. So then we took the gestational history of the mother, the history when the mother was pregnant with this child. The mother has conceived a first male child. He was now 12 years old and is now medically fit both mentally and physically. The mother had an elder male child, but he was physically fit both mentally and physically. The concerned patient was his second conceived child, Saharsh, whom we are talking about. There was no history of abortions or miscarriages. The birth of the patient was eventful. He was born again blue. He was cyanosed also at that time. He could not breathe at birth, and he was again nebulized and kept in NICU for 15 days. So we are seeing that there's a possible hypoxia, or there's no oxygen going to his brain, and also his lungs. He's not able to breathe, and he's all going blue. At 8th month of pregnancy, the mother fell down on her stomach. She had an injury in the 8th month of the pregnancy. Now, this is a very important point that we need to take in account, because she did not have a normal pregnancy. She fell down on the 8th month. This was followed by decreased movement of the baby. The weight of the baby was also decreased after the fall. There was a sonological finding which showed that the weight of the baby had also decreased. After this, she was advised to do a C-section delivery. After this episode, she was advised to have a C-section. Previously, she was advised to have a normal delivery, but after the injury, she was all these events happened. There was the movement of the baby was decreased, and the weight also fell down. So she was advised for a C-section. There was no family history of seizures or any other brain-related troubles, no history of intellectual disability in any child or adult. There was no family history of any intellectual disability, but there was a history of bladder cancer in a relative. Now, these are the physical generals. His appetite was normal. Thirst was average. Could not gargle, that is kulli nahi kar sakta tha, cannot suck from straw. Desires outside food, burgers, pizza, etc. and chatpata food. That is very normal with the kids nowadays, I guess. The aversion was of milk and milk products. Now, this was an important point. Aversion to milk and milk products. Doodh nahi pita tha, and never took, even the milk products. Stool was normal. Urine was sometimes involuntary. His mother complained that sometimes, once in a while, like once in a month or once in 2 months, he sometimes passes urine in his sleep, but no, it was not a regular problem. It had occurred only 3 or 4 times in the past, in the last 2 years. So I guess this was not a very important symptom, because maybe obviously he was not fully, otherwise he was normal, but maybe sometimes his brain used to give, because he was had suffered from seizure also, his brain might be giving a signal that he might not be feeling the urine, but it was not a regular problem. The perspiration was normal, uh, but he had only delayed milestones. Mental generals, at first he was shy, was averse to touching, offered handshake, but was shy to do so. Whenever I offered him a handshake, and he just pulled himself back. But he was otherwise naughty by nature, lack of concentration, does not want to study, shrieks and shouts, gets irritated. Mother has to scold and beat him to study even a bit. There was hyperactivity, wants to watch the mobile most of the time, but mother tried to take it away. As I told you, he was watching and playing the game on the mobile for all the time. And he was not listening to me. He was not answering my questions. And even when I tried to check him physically, he just pulled himself away, and he was like this. Whenever he is angry, he hits his mother. He loves to dance and he loves music. This was a 3+ symptom. He used to bang his head when he had seizure episode. Now he was not doing that, but whenever when in the past he had seizure, he was a bit violent and he used to bang his head. He had fear of dark and ghosts. Physical examinations showed anterior fontanelle open. The anterior fontanelle was a bit open. It was around, I would say, only half an inch. It was open. It was not closed. There was nodular growth on the left side of the neck here. Below the neck, he had a growth here. Had spectacles, sphericals on the right side, plus 3.50 and plus 4.00. And they had grown in the recent years. In the last 2 years, it has grown. The number had grown rapidly. And slight squint had developed in the left eye since last 2 years also. So these all development, that he is also getting affected physically. His number is going, is getting weaker a day, because something is not right there. Now, what are the rubrics that I used? Mainly, I told you before, homeopathic medical repertory, that is 3rd edition by Dr. Robin Murphy. And I also consulted a clinical repertory to Dictionary of Materia Medica by Dr. J.H. Clark, and Borix Materia Medica repertory. I just, whatever the symptoms I noted down, I took the case and I noted down the basic symptom that I was, having in my mind that I need to take in this case. I did not use a software here. I only looked up on these 3 repertories, and these are the rubrics which I took up. Head, brain concussion, epilepsy after. Head brain concussion, mental function altered, children learning disabilities, mind learning disabilities, reading, studying, mind dancing desires, mind hyperactive children, mind dyslexia general's aversion to being touched, food, milk general aversion to, mind developmental arrested head injury after, repertory of causation by Dr. Clark, that is injury head to, and mental troubles from injuries to head. So the basic causa morbi which I thought in this case was obviously the injury that the mother suffered, because after that only there was haphazard events started happening. The baby was not moving. Obviously he suffered a shock inside the mother's womb, and something hit him there, and it started manifesting when his brain's size started growing, when the neurons started developing. The effect started coming after that, and obviously he was not talking till 5 years of age, and also his milestones were delayed. But that is a very this things can happen with any other child also. But after 3 years of age, when his brain started growing, he started suffering seizures, and his neural development was not up to the mark. He did not speak, and obviously the learning disability started showing up. Now, my first prescription was made on 30th November. I studied, the parents were there in my clinic for 1.5 hours. I studied the whole case for 1.5 or 1 hour 45 minutes. And, they patiently waited. I said them, I'll prescribe you the medicine today itself. You'll not go without the medicine. And I studied the case for 1.5, 1 hour 45 minutes. And this is what I gave. Natrum sulfuricum 30-40 drops OD in the morning, along with Saclac in the evening for 15 days. Used to remove the effect of injury on the child brain. As you know, Natrum self is very much used for bad effects of head injuries. It's very much evident in the repertories and in the Materia Medica. Then after 15 days, after the 15-day dose, I prescribed him Calcarea Phos 1M, which was coming as the constitutional remedy because of the delayed milestones and disability, and the inability to grow mentally and also physically. All these symptoms were pointing towards Calcarea phosphoricum. So I gave him natron sulficum 30 for the first 16 days, and then Calcarea phos 1M, followed by Saclec in the evening for the next 15 days. That was the medicine for 1 month. After 1 month, there was no change, no improvement reported by the mother. He came back to me in December. Next prescription was made on 31st December. Calcarea Phos was 1M was again prescribed, OD5 drops for 1 week. Only for 1 week, I gave Calcarea Phos 1M, because obviously the medicine that I had given before that will take time to act. So I gave Calcarea Phos 1M only for 1 week, followed by Saclac for the next 3 weeks. And then follow up on 29 January, the mother said that I called up the mother and I asked, oh, how is he? Because I was very eager to know what he was doing. The mother said that he was calmer than before, does not shriek and gets irritated when the mother coaxes him to study. His concentration is improved than before. He's starting to sit down and listen to his mother now. He's starting to sit, and she's saying that he even takes up the book and tries to read it, that he was not doing before. He's listening to the mother, is sitting there, and he's taking up the books to read. So this was a very positive development that I felt there in this case. And after I again studied up the case, because I was looking for some anti-miasmatic drug also for in this case, so that I can cover up the symptom, and the whole of the symptoms were coming as carcinosin. So followed by Saclac for 3 weeks. So now I'm waiting that I get more inputs in this case. I'm not having many more cases, but this was a case I felt worth mentioning for. So that's why I mentioned this case. So with this, I can conclude that homeopathy can prove to be a game changer in the treatment of genetic diseases, especially involving point mutations. The treatment should be strictly constitutional, as it will yield results. The great philosophy and guidance of Dr. Samuel Hahnemann will guide us into this uncharted territory. So this was all about genetic disorders. I hope I be able to give some inputs and insights into it. Thank you very much.
Thank you, Dr. Neha Kakkar. It's really a wonderful session, an excellent session, a scientific session. And you have once again proved that homeopathy is a scientific system which works at all time, whether it be whether the condition is as a normal thing or an abnormal thing, whatever be, whether it is a hereditary disease or non-hereditary disease or genetic disorder, whatever may be, homeopathic medicine can work. This is what Dr. Hahnemann mentioned some 250 years back. And you really studied all those things in detail, and you are able to collect the real picture of the patient and then apply the science in its beauty by utilizing the repertory, and you got the right remedy, even though there was a little bit of struggle so whether to go with the first remedy or whether to go to the second remedy, or then you have to shift to the third remedy, the carcinosin. And actually, there was a typical picture of carcinosin in all in all, and there was
Yes.
Tarantula was also there, but and you never thought of arnica for the
Yes, sir. I thought about arnica also. There was a battle between me inside me to give arnica or natrum sulf, but I chose natrum sulf because the brain area, and that because I thought that inside the womb, whenever the mother fall, the head would have suffered the most.
Yes,
so that's
exactly. Exactly.
Yes,
Exactly. That's what I was about to mention. But
yes,
instead of going with arnica, you just went to the main remedy, the chronic
yes,
arnica, that is natrum sulf also, that
yes,
works in a beautiful way in these conditions. Anyway, congratulations. I hope that you can make some more presentation in the coming days,
yes,
or coming months, and congrats again. It's the time for discussion, only a few minutes remaining. I think I'm inviting Dr. Ram Parisa to begin the session.
Thank you, everyone. Dr. Dhaneji, and congratulations, Dr. Neha Kakkar.
Thank you, sir.
Very nice presentation.
Thank you, sir.
Excellent session.
Thank you, sir.
Genetic disease, power of heart, nucleus, and mitochondria, also
Yes.
mitochondria. Very nice skills
Yes, sir.
to mind,
Yes, sir.
soul, mind, and physical body.
Yes, sir.
Very nice.
Okay.
Thank you. Just like class physiology.
Thank you, sir.
Now it's
Select remedy, carcinosin, or I am agree, Dr. Dhanesh, natrum sulf arnica and natrum sulf, then natrum phos. There is, thank you, very nice.
Thank you, sir.
Thank
And
you.
now it's up to Dr. Hibbert.
Hello, doctor. Can you hear me?
Yes, sir. Yes, sir.
Very nice presentation, but it is a very difficult thing to understand. But I
Yeah,
want to
thank you, sir.
ask you, doctor,
Yes.
while making medicine, our homeopathic medicines, the size of the medicines will, the size of the molecules, size of the medicine particle will be coming down each and
Yes,
every
sir.
time. The
Yes,
size
sir.
of the nanoparticles will become nanoparticles.
Yes.
Do you think that these nanoparticles, that is up to, I heard that it is up to 8 nanometer will be the size of some medicines.
Yes, sir.
Whenever, if the medicine is having any chemical reaction happening while taking the homeopathic medicine, do you think so?
Yes, sir. We will, I mean, the manifestation of that chemical reaction might be, some aggravation in the symptoms, because we cannot see the chemical reaction taking place. But that will be manifested in the form of certain aggravation, or, some disturbance in the body or something. I don't think so that there will be, like uh, sulfuric acid or certain kind of situation like that. I hope not so that happens. I'm not very much so much involved into the chemistry, but I am just providing background of how things can be introduced, because the homeopathy is working on the energy level, and it's working on the genetic, it can work on the genetic level also. I'm not a very much experienced person in chemistry, but I can always we can make sure that we can try and
Okay,
see
thank
what
you.
can be the results out of
Okay.
our prescriptions.
Oh,
Yes,
okay,
sir.
now I invite Dr. Savi to say some few comments on the same, and you can say what are thanks to this session also, Dr. Savi.
Thank you so much. And we read that from Kant. Kant says the homeopathy is a big science, and at the same time, the other side of the big art. And all of homeopaths learn art side and must be learn the scientific science. And thank you, Dr. Kakkar. Your scientific science is side is very important. Thank you so much. And your case is very good. Maybe firstly, I think that some little time, maybe stramonium is a need your children. Do you think about that?
Sorry, pardon, please, can you repeat the question?
Do you think about stramonium little time giving to your child, your patients?
Whether
Do
you
I
tried,
give some time to the patient? You're asking that?
no, whether you tried
Stramonium,
ammonium, whether you felt that ammonium was the remedy for that patient?
No, exactly, because stramonium patient, it is quite violent, and I did not see any violent streak in that child. I mean, if you have seen that child physically, he was looking like a very intelligent child to me, because he was watching the mobile, and he was quite observant. He was looking very carefully at me, and listening to all the conversation, but he was engrossed in his mobile. He was not, violent that time. He was violent only at the time when he was having seizures previously. Now he was only shrieking in not doing whenever his mother was only coaxing him to sit. So
Thanks.
stramonium child is, a violent, more violent, I think, than this. That's why I did not think of giving. I thought of giving him tarantula also, because there was love for dancing and all those things. But stramonium did not cross my mind. Uh, Mostly it was, battle between tarantula and calcarea phos, and belladonna also. Belladonna. Yes.
Okay.
Okay, thank you.
Yes.
Dr. Savi, you can say vote of thanks to Dr. Neha also.
Yes, thank you. Neha, is your presentation very excellent and very scientific, and your patients good well now. I'm very happy for you. Thank you so much.
Thank you. Thank you, everyone, for listening me. And I hope I can give many more presentations in the future. Thank you so much.
Yes. Tomorrow we will have a session from Dr. Mukthinder Singh, and he will be talking about decoding rubric anxiety salvation, its homeopathic application in materia medica with the cases. So he has presented a part some days back, and tomorrow we will have the second part. With that, we come to the end of the day 1277. It is over to